think we're live.
All right. Well, I'd like to welcome everybody to our lounge, and we're going to do some discussion today on how to advocate with your representatives today. Joining us is Laura Menentello,
Hi, everyone.
Sarah Goldman.
Good afternoon, everyone.
We're waiting on Amanda Baker to come on with us, and I'm your ghost or guest, Eddie Hall.
While we're waiting, everyone, I'm going to deploy a poll for you all. We were wondering, if you don't want to answer, you don't have to, but we were wondering what county you're from and if you're currently connected with a self-advocacy group. So you should see that pop up on the screen in a second. And while we're waiting for Amanda, Sarah, did you just kind of want to go into, I wanted to start off with payfare and the importance of provider rates. It's a huge issue on everybody's mind this session, and always, just especially as self-advocates. I know we all rely on providers. So do you want to start us off with that?
Sure. And I'll just say too, for those of you watching, if you have questions, feel free to drop them in the chat. Laura and I are going to be monitoring the chat, so we're happy to answer any questions. So we're not just the ones talking to you all. We want this to be as interactive as possible. So feel free to drop your questions in the chat. But Pay Fair for My Care is a campaign that the DD Council has been working on for several years now. And this year we are probably further along than we've ever been before. It's so important for direct care providers to be able to have that living wage, because right now they can go work at other places and earn more money than they do taking care of people with disabilities. And our direct care workers really help us. They are essential to our daily lives, helping us go to work, live independently in the community. And, making $9 or $10 an hour is just not a livable wage. And the turnover has just been so drastic over the past few years, especially since the pandemic has started. So I know this year the Senate has currently proposed that we raise the provider rates up to $15 an hour. The House, on the other hand, has only proposed $13 an hour. So they're going to have to go through some negotiations currently to get, a balancing budget. So we're hoping that they'll take the Senate position on $15 an hour. But that's so important. If you all are impacted by this in any way, which I'm sure most of you are, let your representatives and senators know just how important it is for them to hit that $15 minimum wage.
Absolutely. I think for myself too, I can just echo that. Eddie, did you have anything you wanted to add? I think Eddie might be having some technical issues, but I do think Amanda joined us by phone.
I did. I'm so sorry. Technical difficulties. I'm not going to be able to see my face, but I hope you can hear me.
We can hear you.
Okay, great.
Yes. Thanks for joining us.
Well, I couldn't get in the link. I was having trouble, but I'm happy to be here now. So.
Amanda, did you have anything you wanted to add as far as payfare and some of the issues surrounding provider access right now?
Well, I just echo everything that you guys just said, and I know that it's really hard, like Sarah said, with people raising their pay because of minimum wage. We're having to compete with places everywhere. Target, Walmart, they're all paying more than a lot of times we can pay. And it makes it really difficult. And it's also a lot to ask somebody as far as paperwork and background screening and with the waiver, there's the new electronic visit verification. They have to download something on their phone that requires GPS, and So it's a lot to ask of someone. Not only are they doing personal care, which is the most intimate thing that you can do with someone, but they're having to be technologically savvy. They're having to fill out a bunch of paperwork and do a lot of things. So I just put that out there because when you're talking to legislators about this issue, they may understand to a point what a personal care person or a direct service provider, the things that they may do for the person, but I don't think they always understand the extent, and I don't think they always understand like everything that goes into it, the paperwork and all the extra stuff they have to do on top of their actual job.
It's so true. And I know for myself too, I'm in a little bit of a unique situation in that I'm lucky to have family support, but my family support is aging. So I've not had to deal with it as much now, but coming into the point of having to deal with it and being, in a place where you can't really, even when I've tried, I've had trouble accessing providers, and that's on the waiver. It's on CDC, so which is the better thing to be on. So I think that it's just a very scary and vulnerable place to be for a lot of us, for a lot of different reasons. I'm wondering.
And I will say, I'm sorry, I didn't mean to interrupt
Amanda,
you.
go ahead.
I was just going to say CDC is a better option in a lot of ways because it lets you pick a person that may not be a provider. But by the same token, that comes with a lot of responsibility and a lot of additional paperwork. And sometimes it's complicated and it's a lot for a person to take on. So it's really a trade-off. And, the system as a whole really needs to be streamlined. And as much as we need direct care people, I cannot blame them for taking other jobs. The whole system as a whole needs to be streamlined. It's a systemic issue and not just a pay issue.
Absolutely. That does, even having family as providers, I've run into that issue. And sometimes family and, people, aren't the best thing to do, aren't the best people to have either for a lot of different reasons. It is a lot to ask. Sam has a comment, and she says, thank you for mentioning the electronic verification. There are many tasks that a direct support professional has to do for their job beyond the basics. I believe their pay should reflect that. Absolutely. I guess you guys kind of ending on this particular subject, if you, as we're advocating to the legislature about this, what would be your suggestions for those who may be having this issue and may be afraid to speak up or not know how to share their story around this? It's a very vulnerable thing. So do you have any suggestions?
I know that the DD Council has a website, the Pay Fair for My Care campaign. You actually can customize stickers with your face on it and use that like as social media backgrounds, or you can even email that to your legislator. And even just sending an email if you don't feel comfortable calling or having a meeting, we know that that could be really intimidating. So even just shooting them an email saying, I'm a constituent of your district, I am a person with a developmental disability, or I'm a parent of somebody with a developmental disability, or a provider, and just really sharing a personal story. We always say that you want to pull on the legislators' heartstrings because that's the one way that they can't say no to your story. Like they can say no to facts, they can say no to money, but they can't ever say anything about your personal story. So I would say if you're comfortable sharing, whether that's through phone, email, or meetings, share your personal story and customize those stickers on the Pay Fair for My Care website.
Awesome.
I was going to say that I have a suggestion that I have been telling people to do. And that is, you have a very short period of time in person with the legislator, or even if you're writing, you want to be very concise in your statement. So you want, 2 to 3 very key points. And for people that have come to me and asked, well, what should I say? What part of my story should I share? I tell them to keep a journal for, maybe a few days, 3 to 5 days of the things that their support person does for them. And then they can choose the top 3 most important things that the person does and include that with their story. I need my personal care person or my direct care professional because they do these 3 things, these 3 most important things they do for me. And that will give you an idea of what to say.
Awesome. Damien had a question for us, you guys, and he wants to know how COVID has impacted your interaction with your provider, and that has that changed at all in the last couple of years?
Yeah, I can kick us off with that. Yes, Damien, it has changed a lot in the last 2 years. I ended up quarantining with my family the first 3 months of COVID when it happened in 2020, because I was just wanting my caregivers to be able to, stay at home and stay safe. And when I finally re-entered back into my apartment, independent living, within 3 weeks, I ended up contracting COVID from one of my direct care providers and was really sick, which was my biggest fear all along. So it's been a lot of anxiety around, am I going to be exposed again to a direct care provider that's sick? Or how do I know that they're taking proper precautions to keep me safe when they're exposed to so many people outside of when they're taking care of me? And I can't control that. So there's just been a lot of anxiety. I think that the best solution I have found is that I just have a couple of extra backup people so that if there is a situation with one of my providers, that they can adequately quarantine and not expose me. But I have definitely gone through a lot of COVID tests, especially in the last month since Omicron has come through. So I would say that that's just really changed the way that I've had to watch and just take care of myself throughout the pandemic.
I will say that I've really had to stand up for myself. As hard as it is to find people, it's really difficult to sometimes talk to a person who maybe doesn't want to wear a mask or doesn't think that it's important. But in order for them to work in my home and touch my body, they're going to wear a mask and they're going to wear gloves. And that's just the way it is. It's really hard to have those conversations sometimes, but you have to have them. And, you just have to be honest and, say, I respect your beliefs, but this is me and my health. And I have to be cautious because of my health conditions. And so this is what you have to do if you're going to work for me. And I know that's really difficult with the shortage that we're having of direct care professionals, but it's not worth your health and safety at the same time. You have to have those discussions and make sure that they wear their PPE and make sure it's worn properly, because a lot of people don't wear a mask properly, and it makes it more difficult. But you have to not be mean, but be firm about it, because your health is important.
Absolutely. Eddie, did you have anything you wanted to add?
Well, I was gonna say that I'm in a unique situation, I guess, being that I'm married and have a family and everything, and I have several people here that in the family that I have to think about, and they have to think about us, and getting that consensus across sometimes is not the easiest. Recently, I was in Ecuador, and we went for the holidays for 3 weeks, and there were a number of people that wore masks that were in and out of the house, but a number of people that didn't wear the mask, and so we had a lot of parties and everything during the holidays, and everything was fine. But then after the holidays, the new virus started hitting in Ecuador while we were there, and so it got where a lot of in the family started getting sick, and We went and got tested the day before we were supposed to come back, and we tested negative. But yet, when we went to the airport, we had been past the 24 hours and had to be retested, and I tested positive. So Kathy tested negative, but yet because we were traveling together and I needed her care and her assistance, the airlines, changed our reservations for another 5, 6 days. They were pretty flexible with us and allowed us to do whatever. If we felt 3 days were enough that we could retest, that was fine. But when we went ahead and did the 5, 6 days, my passport was about to run out too, so was under pressure with that a little bit. So I waited till the last day, and we tested negative, and everything was fine, and we came back. But it's getting that consensus across your entire family is sometimes not the easiest, but it is what it is. So we're all in this together, right?
Absolutely. I think for me, that's one of the reasons that I haven't transitioned to providers as readily over the last few years as my family. So, absolutely, Eddie, it comes with its own challenges. But, that's just the situation. And I'm glad to hear you made the best of that. And I know we're all making the best of everything. Damien wants to know if we have any tips on what to say to a provider in regard to, I think, Damien, you can correct us if I'm wrong, what Amanda was saying, as far as providers coming into your home, and Sarah, your story as far as contracting COVID from a provider.
Yeah, I think, for me, and this has been difficult because technically you can't require caregivers to be vaccinated, but it's something that I'm asking when I do interview new providers because that's really important to me. And I just let them know that I'm vulnerable, that I have, multiple medical underlying issues, that's something that I'm going to prioritize when I'm hiring people, and they understand. So that's been a little bit of an awkward situation just around vaccination status, but something that I always make sure I say up front. I also, since I have a team of caregivers, I just use a group text, and that's just the easiest way for me to communicate with them because that way nobody feels targeted or feels being personalized. So I'll just before in August when the Delta variant went crazy, I said, we're going to start wearing masks again in the house. Or if you come into my workplace, I would please request that you wear a mask. If we're running errands, please wear a mask. So I would just make general announcements to all of them, so not one of them would feel singled out, and I didn't have any issues in that way. So I'm hoping that if you have a good provider who's going into the healthcare field, they're going to understand why we want them to be wearing masks and why we want them to be vaccinated. Not all of them are that understanding, but hopefully if they're in the healthcare field, they have a heart for trying to protect those of us who are vulnerable.
Absolutely. Amanda, did you
have? It's part of a uniform. Basically, some jobs require a uniform, and to me, a mask and gloves are part of the uniform that you have to wear when you work at my house. It's not. I mean, it's a deal breaker for some people, but those are not the people that I want working for me. If they have an issue with a mask and a glove, then they're going to have issues doing some of the other things I need for them to do because I need extensive support. So to me, it kind of weeds out the type of providers that I want anyway. So it might be frustrating. But I feel like if you find someone that doesn't have a problem with wearing masks and gloves, that, they're probably going to be better and more willing to provide the level of service that you need in general as a whole.
Yeah. Valerie actually had a really good question to you guys in that do you provide the mask and glove and anything you need to your providers? Sarah, maybe you can speak to this a little bit. I had heard, and it may not be accurate, that some of the SILs were actually providing masks and gloves at one point, and I don't know if that's like a an initiative, if that's just an individual thing or something you can't speak to. But
Yeah, I think that varies by the center. I know that they were providing vaccination clinics for providers. They were able to vaccinate PCAs before most caregivers were able to be eligible for vaccinations. But in terms of masks, I always have extras in my house. For the most part, I feel like at this point, everybody just has masks. It's kind of one of those things where you carry it around like you carry your phone or your keys. But I always have 2 extra boxes in my home. So if a provider doesn't have them or just needs one as a backup, I just make sure I have extra on hand. I don't know about you, Amanda.
Typically, I do have gloves and masks available. Sometimes, because of billing and things with the waiver and CDC, there can be times that I may not have something that I need, and I know that others have that problem too. So I will not say that I have them all the time. I try to, but I know it is an issue because, like, this place here would only give me one thing of gloves one time when I was between shipments. And, with COVID, sometimes it's hard to get a shipment of the gloves that you need in the size that you need. So I try my best, but it is difficult at times to have stuff on hand.
while we're on the subject,
I want
sorry, Eddie, go ahead.
I wanted to say I know before when the virus was more prominent, I guess, and there were most companies were requiring all of us to wear masks. All 4 of us are working now, so our employers, I'm sure, I know mine requires that I wear a mask. But the people that come in and out of Home Depot, I'm a greeter, come by me. I see like 500 people a day come by me, and some of them wear, some of them don't. Most of them aren't, and at this point. So because it's not a requirement. So it's similar, I guess, with the people that are working for us as our caretakers, that we might make a requirement that they need to wear one. And if they choose not to, then, they don't have employment with us.
Right. And
Yes,
that's a great
and I will
point.
just say I'm sorry to interrupt, but I wanted to just say that I'm grateful for an employer that requires masks, and I think that there are a lot of COVID dollars, a lot of programs for COVID related things, especially for people with disabilities, and it would be really great to see some of that funding going to the people that need PPE for their direct service providers, because I know of several that have this problem that they don't have it on hand, and some of the people are saying, well, we would wear it if you had it, but you don't, and I'm not going to go get it. So
Yeah, it's so tough, you guys. While we're on the subject of working and provider rates, we all 4 of us work, and I know that there's a lot of other people out there with disabilities that do or want to work. So I was hoping we might be able to touch on working people's Medicaid buy-in, the difference between those 2 things, some of the work incentives that are out there right now. So I'll start with Sarah, and then we can go around to Amanda and Eddie, as you have things to add.
okay.
Yeah, so I know I forget the House bill and the Senate bill number, but there is a Medicaid buy-in bill this year. I'm sure Margaret can throw it in the chat what the bill numbers are. And it's a very vague bill. They basically want to expand Medicaid services for those who are individuals with disabilities, which is different than working people. The Working People with Disabilities program only includes people on a Medicaid waiver, and this buy-in program would expand it to more people who aren't on a Medicaid waiver but still have a disability and want to go to work. So you would be paying a premium, which the premiums would be determined by the Agency for Healthcare Administration if the bill were to pass, as well as the income limits. We don't really know what those would entail. So there's not a lot of information, but I know a lot of advocates have said the Working People with Disabilities program is great, but if you're not on a Medicaid waiver, you can't benefit from it. So this would allow other individuals outside of the Medicaid waiver program to benefit from having employment and earning a little bit more money. Also, the sun is coming right into my face.
I saw that, Sarah, but it looks good.
And just to say, as Sarah said, working persons is a little bit different because it is only for people on the waiver. So that is why we would like to see the expansion, because it covers people that aren't on the waiver. So working persons was a great victory, though, because you can now, if you're on a Medicaid waiver, you can make, I think it's up to $50,000 a year, which is significantly more than in the past, and you can also save more money now. So it's a really good program. I will say that Department of Children and Families administers and is responsible for getting people enrolled in that, and they are still learning on the local level. And with COVID and Social Security offices being down, you may not always get on it quickly, but just make sure you report everything in a timely manner if a program would apply to you. And as long as you can prove that you turned in everything you were supposed to turn in and request what you're supposed to request, when everything goes back to the way it's supposed to be, it will all catch up with itself. So that's what they're telling people. Just keep records of everything and everything that you've reported. So I wanted to get that out. A lot of people are afraid to work. If you're on Social Security or have Medicaid benefits, you're afraid to work. I can tell you, I'm a work incentives planner certified, and there are a lot of work incentives out there. I don't have time for all of them, and I'm not going to go through them because we don't have time today. But if somebody will drop my email in the chat, it's matriarchconsult@gmail.com. And if you have questions about specific work incentives, I can definitely try to help with that. But if you've never worked before and you're on Social Security, you have a period of time, several months, that you can make money, as much as you want for a certain time, and try out a job before you lose anything. And then there are things that you can do after that to save some money towards things, or if you're a student, you might have an exclusion for that. So there are so many work incentives out there, and there's able accounts for saving money. There are just so many things. So if you're out there and you want to work and you've always been afraid, the biggest misconception is people tell me I can only work 20 hours a week and get Social Security and work without losing anything. That is not true. It's different for everyone, but there is a way if you want to work, is what I wanted to say.
Absolutely. I think it's so important. Amanda, I know, just personally, I know you've helped me so much. So I hope that, people take advantage of that. And I just think that this is such an important conversation. Margaret did drop those bill numbers for the Medicaid BuyIn bill in the chat. Thank you, Margaret. It's House Bill 675 and Senate Bill 1692 and 1822. I think we only have a minute or two, guys, but is there anything else that you guys wanted to end on?
I would just say, I know that some of the council members are doing legislative meetings this afternoon. I'm sure Florida Sand has some meetings being put together, but if you don't have any appointments scheduled, it's not too late. Gosh, this sun, it's not too late. I think there's at least 6 more weeks, there's 4 more weeks left of session. But there's plenty of time. This is where the big decisions are being made. So make those phone calls to your legislators, write them emails. Margaret said last night to put in the subject line your position statement. So if it's pay fair for my care, please support, because sometimes that's all they have time to read. They get so many emails every single day. Same thing with phone calls, just make it brief and concise. But I would encourage you to just reach out. It's not too late. And the more we can stand in solidarity together on these issues, the better we're gonna have success. So it's a team effort.
Remember that federal minimum wage is $15 an hour. Pay fair for your care. Let your representative know you want your provider treated fairly, so they will treat you fairly.
Yes, and I just wanted to say that it's important to have a relationship with your local legislators, no matter what time of year it is. So wherever your legislators have local offices that are close to you, research it, find out who your legislators are, and go and introduce yourself to them and make an appointment with them when they're not in session, because they'll have more time to listen to you and you can build a relationship with them. And then when you come to them and needing something, they're more apt to listen to you.
Absolutely. I'll echo all of that and just add to that as self-advocates and people that are more marginalized, it's important to stick together, and there's power in numbers, so we need to have more discussions like this and share our stories with each other out in these forums and outside of it. So just find your people, and if you don't have people, Florida Stands here, the FDC has, other great initiatives. We, all 4 of us are, easily contacted. We'll help you and just stand with you, and we're all going through the same thing. So
there
All
isn't much
right.
you can come to that we haven't gone through ourselves. So don't be afraid to reach out to any of us.
absolutely.
Awesome. Well, I think that's all we have time for today, but thank you to everybody who joined us. We appreciate it. We hope to do more of these in the future. This was fun. I would love to do this again.
Absolutely. I like doing this with you guys.
Yep. Thank you,
Just too
everyone, for
fast.
being with us. We really
Thank you,
appreciate it. Thank you.
Have a great afternoon, everyone.
Bye, everyone.
Bye.